Welcome to YouTube channel Ramesh Kaila. As we know, we just learned about the BSc Nursing 5th SEM educational technology. In that, we have discussed so many important questions for the examination point of view. In that, the curriculum is most important part of the syllabus and examination point of view. We already discussed regarding the curriculum, definition of the curriculum, then the nature of the curriculum, principle of the curriculum, and criteria of the and characteristic of the curriculum. If you want to see, the video number 5 is this type of the video. Now we discuss the curriculum in a remaining point. Curriculum, introduction of the curriculum. As you know that the curriculum is a Latin word, means run, runway, fulfill the goal of education. Curriculum is a blueprint of the all educational program. Curriculum is the best planning of the teaching learning program in education. Curriculum is a pathway of educational program. Curriculum is a written document of all education activity. Curriculum include all learning activity in a education process like teaching, demonstration, field visit, clinical experience, etc. So far is definition concerned, according to Florence Nightingale International Foundation, given the definition about the curriculum. Curriculum is a systemic arrangement of the total selected subject, activity and experience in an education program. According to nursing curriculum, so far as nursing curriculum is concerned, the curriculum is learning opportunity and learning activity that planned by the faculty for the student to learn theory as well as practical and clinical and community area also. So it is the definition of the curriculum. We have already discussed the nature of the curriculum, principle of the curriculum and criteria and characteristics of the curriculum in a previous video. Now we discuss the component of the curriculum. It is also one of the best part for the examination point of view. Component of the curriculum. Which type of the component are included in the curriculum or component of the curriculum are under the philosophy of the education program? One of the most important component of the curriculum is philosophy, then goal, then objective. An examination, we just write that the philosophy of the education, it is important component of the curriculum, goal of the education, objective of the education, detailed course outline of the education, detailed theory and practical education of the program, detail of educational activity of education program, detail of evaluation of education program. That means the philosophy, goal, objective, outline, then practical area, and last one is evaluation, which are the that are the component of curriculum. Now we just discuss regarding the type of curriculum. Which type of the curriculum are available or in a practice? So far as we learn the nature and characteristic of the curriculum. It is also known as a type of curriculum, just subject-centered curriculum, which it is only regarding the subject. Student-centered curriculum, it should be a student-centered, teacher-centered curriculum, learner-centered curriculum, core curriculum, integrated curriculum, activity-centered curriculum, that means the competency-based curriculum, and institutional curriculum. These are the type of the curriculum. How to develop curriculum? Stages of the development already we learned in a previous question. Just we discussed the development of curriculum. It is the deliberated process. Deliberated means it is process after the discussion with the faculties, with the students, with the director, with the chairperson, all members. It is in compliance of the concrete time period. It should be in a timeline. It is emphasized on containment of particular faculty. It is depend on particular faculty. It is emphasized on effort of the particular faculty. It is depend on effort of the particular faculty. The stage of curriculum are progressive, dynamic. The whole stage is progressive and dynamic. Means one by one, means simplex to complex. The stages of the curriculum development are under: first is directive stage, second is formative stage, third is functional stage, and fourth is evaluation stage. As we know how curriculum develop, first we direct means we have some direction for the preparing the curriculum like philosophy, objective, goal, etc. Then we make the framework for the curriculum. Then we functional means it put in practice in a demonstration, in a classroom, in a field visit, in a community area. And last one is evaluation. It is very important stage of the curriculum that if we don't evaluate any curriculum, then it should be a nothing. So first of all, we discuss the detail in a stage, directive stage. Collect all data, collect information regarding the learner's need, identify the brief knowledge concept, select the framework, arrange all data in a sequence. It is the directive stage. In the formative stage, write the philosophy, education, goal of the education, objective, nature of the education, content of the nursing education program. This is the we form which type of the material are we need for the student and for the learner. It is the formative. Then the functional. Plan of the teaching learning activity, plan of the clinical activity, plan of the field activity, plan of the visit, plan of the practical activity of the educational program, plan for the community activity program, plan for the celebration of the special day in an educational program. So these are the functional stage in which type of the demonstration are performed during the education program. It is the functional stage. And last one is evaluation stage. Format the tool for evaluation of the education program. Format the timeline of education evaluation of the education program. Input evaluation of education program. Output evaluation of the education program. Plan for revision if evaluation is not satisfied our goal. Then we must have to revise our educational program also. Then you must have to remember, we must have to remember the 5M before the curriculum evaluation: main, money, material, method and minutes. Main, money, material, method. Main means faculty, money means money, financial, material means paper and tools extra. Method means how, which method is applied, like MCQ, subjective, objective, fill the blank, true, false, easy type. And the minutes mean time bounding. So these are the some clarification regarding the curriculum. First of all, we have learned the definition of the curriculum given by the Florence Nightingale International Foundation. Then component of the curriculum: philosophy, goal, objective, and detailed outline. Then the type of, it is type that the subjective, student center, teacher center, learner center, core curriculum, integrated, activity based curriculum, institutional curriculum. Then the development of the curriculum we just discussed regarding the stages of the curriculum, right, like directive, formative, functional and evaluative stage. Here we finish our video regarding the curriculum. If you like this video, please like this channel. Thank you very much.